Hi, so today I'm filming from a different view just so that you can see how big my belly has gotten. It is pretty big. Now at 148 pounds, my regular weight being 115, 116, and I don't think I have to get up to show, but it's big. It's big. I'm wearing a pregnancy, um, it's like a band, pregnancy band, because I really, really need the support. Um, I don't look so great because I'm not sleeping. Um, I have not been able to sleep well in the past 3 days. My feet are starting to hurt. They are getting swollen. I had already gone half a size up. Oh, and as you can tell, I can't really breathe very well either. I just came home from doing groceries, and there's half of stairs, half we don't live in a second floor, but there's like a half stairs that we have to go up, and it's just exhausting, and just I can't find a lot of comfort. I can't find comfort in driving. I gotta be driving like this because if I'm far too back, then it's a lot of pressure. If I'm too close, then it's pressure on the bottom. So it's kind of awkward to drive. I've been trying to stay away from driving, and just at night, especially too, because I also get tired. Um, I think I'm 35 weeks and like 5 days or so, so I'm almost 36 weeks. My feet, the bottom of my heel on both feet has been hurting, and then some knee pain has started in the past 2 or 3 days. The heel pain has been probably for a week now. I'm trying to just limit the walking, limit if I go somewhere, I'll just be in a chair, I'll just be sitting down because it's the best way. Um, what else has been happening? So at this point, my baby should be about 5.5 pounds. Not sure how big she is. I know she's resting on my left side because I can feel her. I kind of give her massages. Like, I'm not in pain or anything, but all day I think I just like giving her a massage because I know she's there and she probably feels it. Last night, I don't know if it's because I had a little bit of coffee, but she was just not letting me go to sleep. I try to sleep on my left side because, from what I've read, it's supposed to be the best side to sleep on because better circulation, and then you're not putting pressure on your bladder. And then your back is supposed to be bad as well. And I just read a lot about like stillborn. I'm just trying to prevent anything bad. I want to give better circulation to the baby, so I try to sleep on the left side. I used to have a pillow that would kind of raise my left side, but now she's getting so big that I don't really need it. But at the same time, I almost feel like I'm squishing her a little bit. So I have a pillow that I put between my legs, and then I have a pillow that is kind of like big, it keeps my back kind of straight. But it's just it's getting so uncomfortable, and getting up to go to the restroom, I kind of have to roll out of bed or push myself. All that is getting uncomfortable. Um, she's kicking much harder, which is really cute. So that part I'm loving. But I think everything else in pregnancy, throwing up for like a month and a half or two that I was doing, the nausea has started coming back. I'm not sure why. Being tired, um, just the pain from the bottom of the uterus, all of that, I think I've been able to handle pretty well. But not being able to walk that much, it's beginning to take a toll on me because it kind of gets you psychologically as well because you want to do things, right? And I'm already not driving because I'm so tired. And when I go somewhere, and I love dancing, I want to dance. I don't want to just be sitting, but I'm stuck just sitting because then I can feel better. Um, I'm drinking sparkling drinks. I know I shouldn't be drinking soda, but the carbonation of soda is kind of good. I just started drinking a little bit of soda to help me. Um, and what else is going on right now? I'm anxious. I want her here. I'm going to be 36 weeks soon, so I want her here already. So we'll see what happens. I've noticed my hips. My hips have gotten wider. Um, some clothes is not fitting anymore. Or even if I was trying to get away with some of the jeans that I had having a little belt, for the part where you put the button, but that's that's not even something I can do anymore. So right now I'm just stuck with like tights or dresses, and if I wear dresses, I do have to wear the belt that I was talking about, this belt, because if I don't, it's a lot of pressure, and so I have to have something to lift me up. And I've also been wearing the real belt, which gives you support in the back, support here on the bottom, and then it has a strap here. You can find that on Amazon. We've been going to classes, hypnobirthing classes, amazing classes. They teach you how to do breathing exercises. They teach you to do affirmations. If you're becoming negative, to do affirmations that you're going to do during birth. Things such as, you know, a surge brings me closer to my baby. They try to stay away from medical terms that are kind of harsh, like contractions. But we have also been taking hospital classes. If your hospital offers any classes for new parents, for new dads, for CPR, for infants, the classes we've taken has been CPR for infants. My husband has taken the new dad, newborn care. We're going to be taking breastfeeding class next week. And then we've taken a series of 3 sessions of preparing for childbirth. And in that, they also even include like breathing techniques. We were trying to ignore those breathing techniques because we're trying to do hypnobirthing, which is kind of like meditation, like inhaling, exhaling, and just instead of like pushing like you see in the movies. And we keep being told that nothing happens like it happens in the movies. You'll have time. We're gonna have our doula that's gonna supposedly come to our house, you know, if it's that we're able to. And what else? Yeah. Oh, I talked to my doctor about my birth plan, birth preference, whatever you want to call it. Somebody called it a birth wishes, which is a plan of everything that we want that to happen or hope to happen during the birth of the baby. I talked to my doctor. He was really good about it. So I think that's the key thing is we are going back and forth with everything that I want, with everything that he thinks I need, and we were kind of like making decisions together. So now I have to put it together again and get him to sign it and give him a copy, keep myself a copy, give one to my husband, my doula, the nurses. I'll probably make like a good 5 or 6 copies so that everybody's on the same page of what we want to do. I'm still trying to go natural, so just hopefully that's what I can do. Go natural. I might have to be able to be hooked to an IV for antibiotics. I have to discuss this with my doctor. He has told me that I'm able to be on the birth ball, which is this guy right here. So I own this, so if I'm at home, I get to use this as well. And I mean, it's pretty obvious what you get to do. You get to kind of like sit on it. There's something called a peanut ball, which is the same material as a birth ball, and it's different because you're gonna use it when you're laying down, or you're gonna put it between your legs. So that's the difference. So while you can be on the bed in the hospital, and you can put that on instead of pillows. And then they've been talking about that there's a bar in the hospital, like it's a squatting bar, so that sounds like a cool option. I mean, and this is just hoping that, you know, I'm able to breathe and I'm able to keep calm and be able to go from one thing to another. And if I'm not hooked to anything, no IB. There's so many things that I think a lot of women don't know, that we have options. Like, you don't have to be laying in a bed back with your legs up, which is, from what we've been learning, the worst way, because you're going against gravity. I mean, if you look up old school birthing chairs, it was kind of like kneeling forward, which seems more natural. So there's just so many ways that one can do that. So I encourage you, if you're first-time mom, to read a lot, to get a lot of videos, get a lot of information. And if you're also going to do all the classes with the hospitals, or with different, or like Lamaze, hypnobirthing, or just the hospital classes, I would encourage you to read a little bit and learn a little bit, so that once you get to the classroom, you can have a lot of questions and you don't just take all their answers. In the hospital, one of the hospital nurses was trying to tell us that There was hospital policy to not be able, that you could not eat during birth. I talked to my doctor. My doctor said you may not want to eat. You will have nausea, and it might not make it any better. But he's approving for me to eat. So if I want to eat, I can. The hospital will probably not give me the food, like the one that you call and ask for, but I can bring stuff in. So I like having that option. Whether I'm gonna eat or not, I have no idea. I also asked if I could have tea because I identify with tea, and I saw that in Asian cultures, instead of chips of ice, they do tea, and I love tea, so I'm gonna try that. What else?